Hello, it's Philip Geegan from howtobefertile.com. This time I'm talking about IVF and asking, how does IVF work? Well, the basics of IVF are very simple to understand, but when presented in technical language can seem daunting. So here's an outline of all the procedures involved. You and your partner attend your doctor or physician concerning your inability to conceive. Your doctor may or may not suggest taking steps towards conceiving a child by way of IVF. If so, he'll direct you to a suitable clinic. It may be at this stage that you have to consider the financial implications, i.e. how you're going to pay for the treatment. You both undergo some initial testing, such as a sperm count, hormone tests and an evaluation of the uterine cavity. This is both to try and establish the cause of the apparent infertility and to ensure that IVF treatment has the best possible chance of success. Stimulation of the ovaries. Normally, of course, one egg only is produced by the ovaries each month, but when IVF treatment is applied, it needs several eggs to work on in order that the two most promising fertilized eggs out of perhaps 12 or 14 can be chosen in order to maximize the chances of success. The ovaries are therefore stimulated through injections of a hormone called FSH, which is the same hormone that the woman's brain produces in order to stimulate the ovaries each month to produce and release one egg. However, higher levels of FSH are injected than are normally produced by the brain, and this is in order to cause the ovaries to produce several eggs. Examination of the ovaries. The clinic regularly check the number and maturity of the eggs that are being produced. These are contained in fluid-filled structures called follicles, and it is these that are detected by ultrasound. It's normal to have around 4 ultrasound examinations before the eggs are deemed ready. At this stage, the woman is given an injection of HCG, human chronic gonadotrophin, late in the evening or early in the morning. This is to give the eggs a final boost towards maturity before the next stage. Collection of the eggs. Around 36 to 40 hours after the HCG injection, ovulation occurs, and the clinic will aim to remove the eggs just before that happens. This is done using ultrasound. The endocrinologist uses a very fine hollow needle which is passed through the ultrasound probe directly into the ovarian follicles so that the eggs may be gently sucked out. The patient may be sedated to prevent any discomfort. The process usually lasts no more than 15 to 20 minutes, plus an hour or so in the recovery room. Semen collection. At around the same time, the male partner is required to provide a sample of semen. Usually, facilities are provided for this at the clinic. Fertilization of the eggs. The eggs are taken into a laboratory and placed into a petri dish with a culture medium. The dish is placed in an incubator which mimics the environment of the human body as to temperature and conditions. The sperm is then introduced into the medium and hopefully fertilization takes place. The eggs are regularly checked for 24 hours, and if they are fertile, they are left for another 24 to 48 hours before the next stage. Transfer of the eggs. Normally, 2 embryos are placed into the uterus. In the case of a woman over 40 using her own eggs, there can be 3. No sedation is necessary. The endocrinologist places a speculum into the vagina and then places the embryos in a catheter with a small amount of fluid. After the transfer, the patient usually rests for around an hour, but can then continue with her normal activities. After the transfer, the woman may have to undergo a course of drugs to suppress her own hormones, which would last about 21 days, but this would be something to be decided by the clinic. This procedure would place the woman's body into a low hormone state, like a short-term menopause, and may produce similar side effects, such as mood swings and hot flushes. After this period, the clinic will arrange a pregnancy test to see if conception has taken place. If it hasn't, then the cycle can be repeated until successful. If it has, then usually the patient is released to her obstetrician, and hopefully the pregnancy will proceed in the same way as a normal pregnancy. Well, this has been brought to you by howtobefertile.com, and a transcript of this video is available from the page indicated. I hope this has been of use to you. This is Philip Geegan saying have a great day.